blankets, and we go to transfer from the stretcher over to the table, and we leave the bag over there, and we bring the business into the catheter over here, and that causes the patient severe discomfort. So always check under the blankets, because you never know what this patient is hooked up to. My friend who's a nurse sent me this picture one day. It was just an impressive number of IVs. How would you like to go out on a portable and have to deal with this? Yeah, oh, the other side's got even worse stuff. Good try.
Don't pull it.
Yes, ma'am, that is a dialysis machine right now. Yeah, so this patient's hurting for certain. And the dialysis is running, because you see that? When a patient with one strong side and one weak side is being assisted onto the table, what should we do?
B.
Good job. Okay, what in the world is going on with my animations? Yes, strong side closest to the table. And this also applies to doing wheelchair transfers. Okay, if they're hemiplegic, put their strong side close to the table. And that way they can kind of help you get them up onto the table. Monitoring vital signs. Registry will ask you things like, what's the normal temperature in degrees Fahrenheit and degrees Celsius? It's about 37 degrees Celsius, 98 degrees Fahrenheit, roughly. Now, some people run hot, some people run cold, and that's normal for them. Like my normal operating temperature is slightly low. I'm not sure why. It's just the way I am. Pay attention to your patient, okay? If we're performing an exam and this patient, every minute that goes by, they're looking progressively more sick, well, that's something we should be taking note of. What's going on here? Are they desatted, or what is their problem? And be aware. If you have any doubt whatsoever, call your supervisor. Let them know. And that way, if things go south, at least you had given somebody some heads up, so they can't come by and say, why didn't you tell anybody? Fall prevention. If somebody's got one of those wristbands on that says fall risk, believe it. It's probably true. Okay, watch them, because they're going to think, they're thinking that they're, who was that guy? Bruce Jenner, that was running all those races and stuff. That's how they picture themselves, like being this big athlete. That is not the case. Some of these people are really delicate, and if you don't watch them, they'll take a tumble. Excuse me, sorry. And documentation. If anything goes wrong during an examination, it's up to us to make sure. Now, we don't necessarily have to fill out the documentation as students, but we need to point out what went wrong so that the technologists can fill out the incident report correctly. And if you drop somebody on the floor, don't just run away. Tell somebody, at least help them up. Emergencies. Allergic reactions. What do we do when somebody has an allergic reaction?
You stop whatever you're giving them.
Definitely that. Yes. Call for supervisor. Help. Cardiac arrest. If somebody starts to have a heart attack, yes. And most of the x-ray rooms have got a blue button. So we can actually hit the code blue. Although, as a student, I wouldn't do that. Let a technologist, somebody that works at the facility, do that. Unless somebody, if you're putting somebody up to the board for a chest x-ray, and all of a sudden, their eyes go wide, and they grab their chest, okay, then it's probably permissible to hit the blue switch at that point. Because you can see that this man is in a lot of trouble. Respiratory arrest. Some people don't really think too much about respiratory arrest, but it's a major problem. If your patient stops breathing, then they're going to not be supplying themselves with oxygen. That's just as dangerous as a heart attack. Physical injury. Hopefully our patients You know, of course they're injured or else they wouldn't be in here for x-rays, but we're gonna try not to injure them anymore. But if somebody does, you know, get cut or take a fall and hit their head on the corner of the table, that's another issue that we might have to deal with. And again, seizures. These are all reasons to call for help. You're going to see people come in with blood sugar problems, low blood sugar, high blood sugar. You know, diabetes is a big problem in the United States of America, something that we have to be aware of. And infection control. Be familiar with these terms. A pathogen, you guys know what a pathogen is. It's like a germ or a virus. It's something that can infect you. It's out there. It's all around us. However, without a reservoir is a place to kind of hide out and grow. A portal of exit. What's a portal of exit? A cough, a sneeze, you know, your mouth, your nose, those are very common. Some diseases spread by fecal matter, okay, so there's another portal of exit that's rather unpleasant. Modes of transmission, indirect, okay, there could be germs in the air that you could catch. There could be germs on a table that you come in contact with, versus direct. Direct infection is, you know, I've got a cut, now you've got a disease too. You're welcome. Portal of entry. Portal of entry. Your eyes, your nose, your mouth, possibly ears, skin in some cases. Especially, now normally your skin forms a bacteria-proof barrier. It's really good at keeping out bacteria. However, if you've got a cut on your hand, then watch out. Because now you've got an additional portal of entry, and especially in a patient care environment, you have to protect that. You don't want to get MRSA, you know, any kind of a staph infection, VRE, all that kind of stuff can enter you if you're not healthy and taking care of yourself. A susceptible host. Now, we're all susceptible hosts to some extent, okay? When the flu comes around, nobody is flu-proof. We've figured that out this season. But this is really more from our patient standpoint. We're supposed to be protecting these guys. A lot of our patients, they might have had like a liver transplant or something like that. They are on immunosuppressive therapy for the rest of their life, which means that they are extra susceptible to diseases of all kinds. So we have to be careful, and even if patients aren't on some kind of a crazy drug like that, these guys are sick, okay? And when you're sick, that means that your body is already in a depressed state, you know, as far as being able to fight diseases off. You're susceptible to getting more disease, which is why those nosocomial infections, you know, we're trying really hard to prevent our patients from getting even sicker. I don't know why. Well, okay, I guess I could. The ARRT likes to ask about these things. Aseptic versus sterile technique. What's the difference between medical asepsis and sterility? Well, it's,
Yeah,
yes?
like, most versus all.
Yes. To put it in a nutshell, medical asepsis, this is where we are wiping down the room with Virex. We're trying to clean our cassettes. We're trying to get rid of as much germs as we possibly can. We are on the hunt, and we're spraying everything down that we touched or that the patients touched. We're trying to keep our rooms as clean as we can get them. Surgical asepsis is something else. This is sterile technique. You guys all know how to open sterile packages, sterile gloves. If anything gets contaminated, what happens?
Trash.
It all goes in the trash. Okay, we can't have any contamination. This is an attempt to keep the place microorganism free. And the OR, theoretically, you know, you go in the OR and you've got sterile versus non-sterile areas. Okay, in the areas that are sterile, we take special care not to run over with our C-arm, you know, because that would just be frowned upon. The process of eliminating as many organisms as possible by the use of water and disinfectants. C, medical asepsis. Okay, so you guys have got, I'm kind of driving this home because whenever I was a student, I was totally confused. I mean, my head was spinning. I couldn't figure out the difference between sterile and aseptic. I don't know why. It doesn't seem like it's that hard. CDC says, use standard precautions. Precaution number 1, wash your hands before and after every patient. Supposed to. Have you guys ever heard that old joke about technologists are the only people in the world that wash their hands before they go to the bathroom?
Yes.
I think there's probably other disciplines that do this. I do that. I'm like, man, okay. Whatever's on these hands is going to get cleaned off first. Okay, wear your gloves and gowns if needed, and masks. Okay, protect yourself every chance you get. When you're starting IVs, I know I come from the school of bare knuckle radiography. You know, I start IVs barehanded. Well, okay, I used to. We're not supposed to be doing that. Have y'all ever seen a technologist like put on gloves and then tear the finger off?
Point to point.
Exactly.
But they swab their finger with alcohol first.
Well, I can mop down my whole hand with Purell or
I know.
whatever. Yeah, we're not supposed to be doing that. That's not considered as, you know, CDC best practice. Contaminated items. Okay, this is the kind of thing you also see questions about. Anything that's got blood on it goes where? Into the dumpster? No, into a bio bag, a biohazardous marked bag. What about needles? Can we just throw needles into the garbage can?
Shark fin.
Sure we can, but we shouldn't. Those are supposed to go into the shark's bin.
So the sheet has blood on it.
Sheet has blood on it. That's supposed to go into a bio bag and then go back to central stores.
What about if it's like, fecal?
Fecal matter. Fecal matter, same thing.
Pee or-
It needs to go into a biohazard bag and then go back, because, okay, just because a sheet has got, okay, if we threw every sheet away that got crapped on, then we'd soon be out of sheets, okay? So those things go to the laundry, and the laundry, you know, they have specific methodologies for dealing with that kind of stuff. If they judge something is too far gone, then they'll incinerate it. All surfaces must be cleaned immediately. If in doubt, clean it with Virex. Common vehicle transmission involves what? Okay, C, food, water, medications, equipment. I like it. Very good. Another word of precaution for you. Okay, contact precautions. Some diseases can be transmitted just via touch. Absolutely possible. Droplet precautions. Okay, this is where if somebody coughs and they cough out a wad of something, you know, or just drops of fluid, droplet transmissions, yes, okay, we don't want any of that. Airborne, okay, airborne transmission. Some diseases, tuberculosis, for example, can transmit by way of just air currents. Neutropenic, have you guys heard of this?
No.
Some of the patients at the hospital are in what's called reverse isolation. They're in a high pressure room that has seals around the door so that when you open the door, the air blows out, but it's supposed to keep any air from the outside from coming in. These patients are very immunocompromised. So we have to take special precautions to make sure that they don't get subject to any further infection. When we're going out to do portable x-rays on these patients, which we do from time to time, we have to make sure that our cassettes and our machine and we are as clean as we can possibly get them before we roll into this patient's room. Because we're not so worried about catching a disease from them, we're worried about them catching a disease off of our plate. You know, that's a real thing. Nosocomial infections. You guys know what's the most popular nosocomial infection? UTIs, very popular. Pneumonia, the most popular, yes. But yeah, you know, if you stay in a hospital long enough, then especially if you've got a catheter in place, your chances of getting a UTI are pretty high. You could also wind up getting MRSA, but pneumonia is the number one. When people get to the hospital, they almost immediately start treating, you know, proactively or prophylactically, thank you very much, against pneumonia. And the other thing they've started doing, I don't know if y'all are aware of this or not, when patients come in and they're going to be in the hospital for more than a couple days, they will go ahead and start dosing them with something like heparin or warfarin, something like that, blood thinners, you know, to keep them from developing a DVT. All right, well, we'll have to see the rest of this presentation later because I see by the clock on the wall we've run out of time. But don't worry, we're going to get back to this later.
That's